Professor of Infectious Diseases, Epidemiology, Director, Global Health and Infectious Diseases Control Institute, Nasarawa State University, Kefi, Nasarawa State, Professor Ishaku Akiala. Thank you so much for being with us on the program.
It's a pleasure having you. Good morning, Nigerians.
What's going on?
A lot has happened from the virus being discovered in 1969, over 50 years, till the year 2026, with a fractured healthcare system that has been fractured, with over 80% of our primary healthcare centers not having potable water, with having over 110 deaths of children in 1,000, accounting for 1 in 9 children die in less than 5 years, with over 1,094 women die in 100 live births, with a higher mortality rate, with a lot of things happening within our public health ecosystem. A lot of things have gone wrong.
Is there a cure for Lassa fever?
Of course, there is a treatment for Lassa fever.
There's a treatment for it?
Absolutely.
Is it preventable?
It is preventable.
How are people dying from something that is preventable and curable?
Because
dying so in these massive numbers in 11 weeks?
Because it's not our priority as a nation. It's not our priority. That is only Lassa. We are not talking about diseases that are vaccine preventable. We are not talking about children still dying of measles. We are not talking about children still dying of diphtheria. We are not talking of people even dying of cholera, a disease that if you provide water, you take care of it. It's a social disease. We are not talking about those diseases. So I think we just lost it as a country. And I hope that this conversation that we are trying to bring up is going to spur a national conversation that we just need to be deliberate about Lassa fever. Because in 50 years, Kela, we have not developed one single diagnostic tools. We're not talking about even drug development. As a nation, we have not. So we are still doing a paper-based reporting system instead of real-time transmission of data of cases. In 50 years, or over a half a decade, we still have medical doctors dying of something that is preventable.
How do you get infected with Lassa fever?
Of course, yes, you get infected if your food product are being contaminated with fecal materials from the rat.
Okay. Any rat?
A special rat.
A particular rat?
Yeah, a multi-mammal rat, mastomi species. Because the rat harbors the virus as a normal flora. So in the rat, the virus does not cause disease in the rat. But they are being shaded. There's what is called viral shading in fecal materials and also fluids from the rat. And so they get contaminated, food product get contaminated by this product of the rats. And then once humans ingest the virus from our food products that we get infected. Secondly, you will also know that there is also the human-to-human transmission. So
I'm sorry, Doctor, Prof, just so I can situate that.
Yes.
So this rat, I'm assuming, will eat things like potatoes and onions. And
absolutely.
So when you spread it in the store.
Absolutely. So we dry them. We dry our cereals.
Yes, we dry our. So when you spread your cereals as well. Of course. So once they come in contact
in search of food, they come in search of food, and then the food that we spread can be contaminated with their fecal material, with their salivary, discharge, because they are looking for food to eat, and actually they come around places that are dirty.
Okay.
So that brings about issues of environmental sanitation.
This particular rat, we have a lot of it in Nigeria.
We have a lot of it, but geographically, if you do the hotspot mapping of this availability of this rodent density, it is within the belt that we are experiencing this Lassa fever. You see them vulnerable within the middle belt region. So that you get higher cases in Bauchi, you get higher cases in Benue, down to Nasarawa, part of Edo, and now Ondo states. So they are belts that are of Guinea savanna outlook in terms of nature.
So just and I'm gonna get Ayo to ask you a few questions right now about this. So we're looking at a disease that is number one, preventable.
It is preventable.
Curable.
It's curable.
You can map where these rodents are.
Absolutely.
You can actually take action against them.
Absolutely.
But nothing. And now 146 people dead in 11 days.
Absolutely.
All right. Ayo has a few questions for you. Go ahead, Ayo.
Thank you, Kayla. It's also a little disturbing, Prof, that it is mostly seasonal. In other words, we can tell that this is going to come at about so time of each year. So why then don't we seem to be able to get ahead of it?
Because we have not brought people like Ayo and Kela to become ambassador for Lassa fever elimination in Nigeria. So what that means is that we have not done enough in terms of public health advocacy. When I was at the waiting room, I was thinking over it when Professor Oke was talking. I said, I wish I have the powers to appoint Ayo or Kela as ambassador for the Lassa fever control. We have not done enough in terms of coordination, in terms of strategic public health advocacy. We know because Lassa fever is seasonal in nature. Between the months, the dry season, that is when the incidences, we do see upsurge, but we have not done enough. Secondly, Ayo, we have not done enough in terms of also developing our resilient health system structure. How many states have the capacity to test Lassa fever? Very few. We still ship samples to Abuja. We still ship samples to Urua in Edo State. We refuse to build our system. I thought maybe would have learned lessons from the COVID period. A lot of labs were developed with the capacity to test COVID. After COVID, we never had a national policy to repurpose those labs, be it public lab or be it private lab, to see how we can be able to test this. So I asked how many states have state public labs, public health labs. Very few, you can count them. Lagos is doing well and very few states are doing well. So we have not done well, even in terms of understanding. We have not even done well in terms of research. For 50 years now, we have not done well. Can you go to every state to also look at the budget line, even a national budget line, whether we have a budget line for research? We have not even met up with the Abuja declaration of 15% for allocation in terms of health. So we have a lot in our hands. We are supposed to declare a public health emergency in our healthcare sector.
Well, even the same Lagos.
Continue in the 20.
Well, Prof, my apologies. Even the Lagos that you talked about fantastically well, as Lagos is doing, as you have said, the State Commissioner for Health raised the alarm on Saturday that as a nation we are grappling with one of the worst cases of Lassa fever outbreaks. Professor Abayomi said we have logged more than 660 confirmed cases and a heartbreaking 167 deaths from January to the middle of March. And according to the Commissioner for Health, and according to him, the outbreak has spread to 22 states and across 93 local government areas. And as you have also said, Prof, this thing is predictable. Now, on the average, if you can just give us an idea, how long does this outbreak really, what season of the year does it come and how long does it usually last?
So it lasts between October down to April every year. That is the season, basically dry season, because those are the seasons that the rats, leave the bush and you also come down to have an interface within our households. You will also understand that in Africa, most especially in West Africa, Sub-Sahara, we use this rat as source of delicacy, as source of protein. So it is within that period that we engage in bush burning, and then we tend to disrupt the ecosystem of the rodents, and then they now find their ways within our households.
Okay, so just to also be clear, my apologies, just to also be clear, these things happen mostly in rural or suburban areas, or do they also happen in urban Nigeria?
Infectious disease has no boundary.
Talking about this Lassa fever in particular.
Lassa fever in particular tends to be a disease of the rural setting based on the demographics we have seen over time and the transmission dynamics.
Okay, now I also know, my apologies, my sincere apologies. I'm just trying to get some facts out. Talk to us about, because when I was growing up, probably you as well, there was a time when environmental sanitation officers went to people's houses, be it rural or suburban. They went to people's houses from the local government administrations to ensure that, you know, they did right by themselves, they weeded what needed to be weeded and all of that. So environmental sanitation officers went out, health officials went out to ensure that people did right by themselves. Do you think that system still exists, or it's totally broken down and needs to be rebuilt, Prof?
That system existed before. It was totally broken, and there is need for us to rebuild that system, because environmental sanitation is quite key in handling diseases that are quite preventable, diseases that we might have used the non-pharmaceutical measures to tackle them. Diseases like diarrhea, diseases like cholera, like even Lassa fever. So I strongly believe that the system that we had in place before, where environmental health officers move around in the northern part, we call them Dubagari, where we call them, they come to, to search, but what is also quite key is that I've been involved. I was hired by International Red Cross to actually develop the national cholera plan for the country, and also a lot of policy document for the country. And one of the major gaps that we saw is even the wash component in most of our healthcare settings. There is near to zero presence of sanitation even in our healthcare settings. How many companies, how many people are trained to handle hospital waste? As a country, we don't even have a working document, a framework for waste management in our healthcare setting. This also calls for because a lot of infectious agents. There's a concept called nosocomial infection. These are hospital-acquired infection that you get the infection within healthcare setting, and then we are unable to also practice proper sanitation within our healthcare settings.
You mentioned the environmental officers, the
Dubagari. Yep.
And it used to be a thing in northern Nigeria.
Absolutely.
Where they are coming.
They are coming.
So we used to try and clean up our community
Absolutely.
before they get, because the dirtiest house will be on TV.
Absolutely.
They would film the street with the dirtiest gutter.
Absolutely.
So it also, it fostered some kind of competition between streets and communities.
Absolutely.
And that was how we made a lot of friends, because you wanted to be the one that said that your house is on TV. We are the cleanest house,
Absolutely.
But that doesn't exist. And for many people who were a part of that process before, they say the issue is that our health sector is run by doctors.
Yep.
Treatment. The prevention bit is ignored.
Absolutely.
Largely.
Absolutely.
Is there a national Lassa fever plan for Nigeria?
So we have a national Lassa fever plan for Nigeria. It was developed 3 years ago. It was launched. But you have to look at the implementation. In the Lassa fever plan, there are areas of coordination. There are about 6 to 7 pillars in terms of diagnostics, in terms of logistics, in terms of case management, how you manage cases. But it brings, in fact, there is a pillar called research and development.
Okay.
But when it comes to the implementation, it's not fully implemented.
Why?
Because of funding.
The NCDC is not getting funding?
In all honesty, even the Federal Minister of Health says that the 2025 budget that was released was just 1%. Is that okay? So even the fight of Lassa fever, it is donor dependent. And another thing again is that the state refused to own this fight. So the Subnational refused to own this fight. They leave the treatment to the NCDC, which is a federal arm. They leave the diagnostic to the federal arm. They care less about it because it is donor dependent. I was going through the budget line for 2026. I've not seen anywhere that talks about health emergency. Of course, the concept of public health is about global health security. So we have not been able to see those indices. And we have not also seen a lot in terms of research and development. I come from the academia. And Kela, I want to say that if the president should give a bounty of 1 billion naira for a diagnostic kit to be produced in Nigeria, within 24 hours, we'll get it. If the president just said Here is 1 billion naira for somebody to design a model of a vaccine for Lassa fever that works. Within 24 hours, you will get it. Nigeria is so endowed with human resources that we have not yet harnessed those human resources.
Let's curate it very well. So in case the president hears this.
Of course.
So 1 billion naira.
1 billion.
Sent where?
Sent to either the Nigerian Medical Laboratory Science Council, which is in charge of all the diagnostics, or through NAFDAC, or through Pharmaceutical Council, just 1 billion naira. And just through a national challenge. We need drugs. We need diagnostics. We need vaccines. Kela, we also need AI-enabled digital platform for surveillance system.
1 billion naira.
Well, just 1 billion naira. And we have released over 27 billion naira for revalidation of voters' cards. We are not a serious country. United States of America just brought 4 of the astronauts that went to space through NASA. Do you know how much it was invested? So we are not a serious country, Kela. We just need to be deliberate about it.
If 1 billion naira was available, 146 people won't have died in the last 11 weeks.
Why? Kela, because we don't have a rapid diagnostic test kit that you can test for these. Because the clinical presentation looks similar like malaria that all of us, come down with. So we just need an indigenous rapid diagnostic test kit and 1 billion naira, I can tell you. Just give the National Medical Laboratory Science Council 1 billion or 2 billion naira. Just put it in their budget and release it and throw a national challenge and bring guys all over the country that are even in diaspora to come. So we can also introduce the Brain Drain, Brain Gain project to see how Nigerians that are doing well in diaspora return back home. We have an emergency, which is Lassa. Can we come together to develop? Kela, with all the deaths that we have been experiencing of Lassa fever, we never had a National Lassa Fever Summit as a country. We have never had a National Lassa Fever Summit or National Lassa Fever Conference. So I'm advocating that we need a technical working group nationally, just like the way we had for COVID, in terms of national health emergencies.
People are sending you messages. People are sending you all kinds of messages here. But one of the major things that people are asking, what states should be doing, because you talked about it earlier.
Absolutely.
States owning the process.
One of the success stories we have for HIV and AIDS is that we have what is called the NACA, which is the national. We have the SACA, then we have the LACA. So it is more like a bottom-top approach. Is that okay? Those are the kind of things that we just need to inject innovative ideas in handling our healthcare emergencies. Of course, for sure, I'm the advocate that we used to have Dubagari for environmental health. What stops us from having health corp marshals?
For people that don't know what Dubagari means, it's environmental workers.
Environmental health workers.
Environmental health workers.
So state needs to own this. Let me share something with you. My state doesn't have capacity to test for Lassa. And we are endemic. Benue doesn't have the capacity. And they are endemic. And Kela, 1 billion naira can set up a molecular lab to test for Lassa. We are not a serious country. We are not.
Well, we brought it to the fore, the value of the Nigerian life. We are going to up that value.
Absolutely.
We are going to up that value.
And I'm looking forward for people to appoint you and Ayo as ambassadors for
Lassa
fever.
We are here. We're here for you. But while we're calling on the president and everyone involved to get, you said 1 billion naira will get this sorted out. Meanwhile, for the Nigerian people, cover your food. Cover your food and pots lightly. I think it's a little difficult because of the weather. It's getting damp. So when you buy onions and you buy potatoes and yam, you leave them open. Even when you buy garlic, you can't keep it in the fridge. You have to keep it open.
Sometimes.
So what do we do now?
Sometimes the food products are even contaminated in the market. We'll bring them home.
Yes, because they're outside in the market.
We don't have enough water to wash them properly. So even the availability of water is quite key. Once we provide water, so
what do we do with our potatoes
now? Food hygiene and food safety. Make sure that our food are properly cooked, our food are properly covered, and we should make sure that what we eat is actually safe.
All right, so the advisory, cover your food and pots tightly, block the holes where rats enter your house.
Absolutely.
Wash your hands thoroughly with soap. But I think the key is to sing the alphabet when you're washing your hands. Most people don't know this. They just go and they wash their hands. It takes some time for the soap to react with your bacteria.
Absolutely.
So you wash, you sing the alphabet, A to Z. That's 26
Kela, you are already an ambassador.
Yeah, that's 26 seconds. We had to learn this during COVID.
Absolutely.
So you have to wash your hands, sing the alphabet song,
Absolutely.
A, B, C to Z, 26
Absolutely.
seconds before you're done washing your hands.
Absolutely.
And if you have a persistent fever, please stop swallowing random drugs from a chemist. Go to the hospital and get yourself treated immediately. Thank you very much. Professor Ishaku Akiala, Professor of Infectious Disease Epidemiology, Director, Global Health and Infectious Diseases Control Institute from Nasarawa State University in Kefi. Thank you again.
Thank you, Kela,
for being with us on Sunrise Daily.
Thank you for having me. Well, good morning, Nigeria.